Every year, millions of women experience vaginal discharge from conditions such as yeast infections, bacterial vaginosis, chlamydia, and gonorrhea. Women often self-diagnose and often misdiagnose the issue as a yeast infection and treat it with anti-fungal cream from over the counter. The traditional vaginal applicator is the only device used to deposit medicated creams into the vagina. Vaginal applicators have been used for many years without any changes or improvements. The misdiagnosis of vaginal symptoms as yeast infections not only renders the yeast medication less effective, it also leads to consumers wasting millions of dollars each year and contributing excess waste to our environment. The lack of efficacy of the traditional vaginal applicator can be attributed to a few factors. The most important factor is the physiology of the vagina itself. As a self-cleaning organ, the vagina's rhythmic muscular contractions naturally flush out any substances from its canal. Therefore, it will expel cervical secretions and menstrual blood, and also any therapeutic creams. In an attempt to address this issue, Dr. Alfred Shahada developed the showerhead applicator, an alternative design to the traditional flathead applicator. This applicator had multiple perforations in a rounded head to distribute therapeutic creams in multiple streams rather than depositing it in one thick glob. Unfortunately, the showerhead applicator did little to improve on the retention of vaginal and medicinal creams in the vagina. The muscular contractions of the vagina continued to expel the contents despite the showerhead's design redistribution of the medicine. Dr. Shahada's next development involved his uniquely patented reusable FemCap, made of medical-grade silicone. The FemCap works by fitting snugly over the cervix and is held in place by the muscle contractions of the vagina. Properly fitted, it can hold cream on both the vaginal and cervical sides of the device. To prove this concept, Dr. Shahada recruited 40 women for a clinical trial. Half the women applied a stained vaginal cream with the traditional vaginal applicator, and the other 20 used the FemCap to insert the same cream. He then compared the retention and distribution of the stain for each device. The results were this. The stain was visible over the cervix and upper vagina after 24 hours when applied with the FemCap. The stain was absent after only 12 hours when applied with the traditional applicator. In conclusion, the FemCap delivery system is more efficient in delivering therapeutic medication to the cervix and vagina than the traditional vaginal applicator.